today, what I'm going to do is show you a little breathing technique to give you a little bit more thoracic rotation. So what I'm going to show you is I'm going to show you my thoracic test. So I'm going to do it from here so you can kind of see how far my alignment stick goes towards the camera. So knees together, hands behind, and then I'm going to rotate. So if I rotate, you can kind of see I'm not quite pointed at the camera. So I've probably rotated maybe like 35, 40 degrees. We're looking for at least like 45, 50 degrees. So what we're going to do is we're going to start off with breathing. A lot of times I like to have the head elevated so that can relax the neck muscles. A lot of people that have forward head posture, these things are, kind of either tight or just overworked. So this puts it in a position for it to relax so we can use the stuff that we want to use when we breathe. So what I'm going to have you do is you're going to place the hands on the ribs. And I'm just going to have you start out with just breathing in, just normal. And then when you breathe out, try to breathe everything out. And you're going to feel like the ribs, so if these are my ribs here, like they're coming down towards each other and going down away from the neck. And whenever I'm doing this, it's almost like a little bit of a neck tractioning as the ribs are coming down. And you're going to give me another breath. So we're going to go about 5 breaths, just breathing out, breathe everything out. We'll go one more. You're going to go full exhale, almost like you're going to feel like you're trying to get that breath onto the ceiling. So you feel a little bit of the abs working, pull the ribs down. Now, after we exhale, the ribs are going to come down. And then you're going to think about breathing wide, almost like you're breathing into your armpits. So we're breathing into those ribs. So after I exhale, and the ribs are pulled down, I'm going to think about breathing wide. And then full exhale. Now I'm going to do 5 of these. Breathe wide. Full exhale. So the ribs aren't coming up with it. I'm trying to breathe wide. So I'm thinking about kind of breathing in between the ribs. Now you may notice that with your fingertips, you may feel like one side gets some air and the other side doesn't get any air. So a lot of times, for most people, it's a little bit more difficult to get air into the right side. Just through life, but also especially if you're a golfer, you have the right shoulder lower, a lot of the time, so that can compress down on the spine. So what we're doing is almost like creating space between that right shoulder and that right hip to help with getting a little bit longer and increasing your mobility that way. So you're gonna go one more breath. Full exhale. Now on this, I'm gonna bring the arms up, and as I exhale, I'm going to bring the arms back, but I'm not going to go all the way to the floor because I can't, or I can with the left arm but not the right. So from here, arms are trying to reach for the wall behind me. I'm just going to go breath in, full exhale, bringing the ribs down. So that means I'm getting a little bit of length from my lats now as the ribs are coming down. Might get a little bit of shaking, which is fine. And as you're going through these, if you feel like you can breathe into one side more than the other, try to feel like you're breathing in the side that's more restricted. So for me, definitely, and for a lot of people, this right side is restricted, which a lot of times why people have that right side low back pain. So now I'm going to try to breathe within that right side. So try to bring that breath into the right side. Full exhale. One more. Breathe wide in that right side. And then come back up and relax. So once we did that, we kind of open up the rib cage a little bit, get some space within the ribs. And what else is going to shake out with that is also you'll probably get a little bit more neck rotation. So let's see how much that improved. So I'll go right over left, keep the knees together. So I'm trying not to cheat. So hands behind, and then I'm just going to rotate to the right. And you can kind of see, like I was there, and now I've opened up, quite a bit, like probably about 20-ish degrees, just by doing a little bit of breathing. So from there, after I open it up, now we'll go to our other T-spine mobility drills.